It doesn't matter what kind of doctor you are, you're going to have someone on the spectrum come into your office. We have the number of 1 in 68, so they're coming. One of my most humbling encounters with a patient on the spectrum was when I walked into a room and there was a little boy who was making eye contact with me and who was very, very, very smart and seemed to be loving our interaction until I took my stethoscope out. It surprised me because I'm used to seeing patients on the spectrum, but I usually have a clue as to what's coming, and I really didn't anticipate the level of pain that was causing that little boy, because I think I took his intellect and his excitement about our interaction, and I assumed it was going to be okay to do the next step. That was humbling. It made me remember A plus B does not equal C in the world of autism. We as physicians have a routine, whether it's conscious or not, of how we walk into a room, how we gather information, how we do our exam. We might have to just completely revamp that, mix the order up a little bit, change the way that we communicate. One of the biggest things we can do is pause and see if there's someone in that room to help guide us, be it the patient themselves, be it a friend they've brought with them, or the parent of the patient. Because there aren't classes in medical school about autism. There's some creeping into some schools across the country, but it's not something that's formally being embraced. And why should it be? There's other issues out there. There's Alzheimer's, there's dementia, there's things to learn about: diabetes, hypertension. Why should autism get a spotlight? It should get a spotlight because when we are trained in how to stop, pause, think outside of the box, go into the world of a patient with autism, that pause and approach and learning to examine someone or even talk to someone on the spectrum is going to trickle over to every patient we see. Someone with a language communication barrier, someone who has anxiety, someone who has depression, someone who has dementia, someone who just doesn't like coming to you. You're going to have learned through getting learned in how to speak with and examine patients on the spectrum, how to stop, pause, readjust, change your routine, step outside of the box. It takes you 2 minutes to make a huge difference. And that's really why we all went into medicine in the first place.